I'm Andy, and we're going to talk about how to do a chest tube. All right, so some indications for a chest tube might be that you've had multiple unsuccessful needle decompressions, you have an extended transport time, or you have a delayed tachyvac. The first thing we're going to do is we're going to prepare the patient by putting them in the supine position and go ahead and have the affected side of that arm and raise it above their head. We're going to identify the area and then clean it appropriately. In this situation, it's the left side of the chest. We go to the mid-axillary line. We go to the fifth intercostal space, which on males is about the nipple. So you just go just anterior to that fifth intercostal space, mid-axillary line. All right.
In females, the nipple may be displaced inferiorly due to the large pendulous breast. So remember to stay above the inferior mammary fold where the nipple would normally lie.
Ensure that you use some sort of antiseptic, whether that be iodine, chlorhexidine, whatever it may be. Just make sure you use something that is a good antiseptic because you are going to be entering into the chest here. Okay, our next step in this procedure is to go ahead and anesthetize the area. An appropriate local anesthetic might be 1 or 2% lidocaine and possibly Marcaine also. Go ahead and insert the needle into the skin and go ahead and start to infiltrate the anesthesia into the area. Go ahead and make sure you aspirate as you go in. Continue to infiltrate the area and then get right over the periosteum there and make sure you provide adequate amount of local anesthetic. All right, the next step is go ahead and make our incision. Go ahead and take your blade, find your landmarks, make a 2 to 3 inch incision. Down to the rib. Go ahead and you feel the rib there. Once you have incised down to the rib, you go ahead and take your 9-inch pins, blunt dissect over the area, go right over the top of the rib, into the chest wall, and expand your pins. Take it out. Go ahead and stick your finger into the chest wall over that rib. Go ahead and you're going to rotate your finger back and forth, making sure there's no adhesions and that you're inside the chest wall. Let's talk real quick about using your pins to grasp your chest tube and insert it into the chest. You can see here we have the fenestrations along the part of the chest tube that goes inside the chest. You can also see that it is numbered out here. You're going to take your pins. There are a couple different ways you can do this. You can pinch it here at the end to be inserted. Another method might be to put the pins through one of the eyelets to be inserted into the chest wall. And you should use something that you feel comfortable with and that you can practice and that you can do whenever you have to put in the situation. Okay, so, and this would be called, if I were just to do this by itself, this would be a finger thoracostomy. So if I have someone who may have some significant trouble breathing and I'm not getting that relief with those needle decompressions, this may be a step that is appropriate. But here we're going to go move forward with our chest tube. My finger's in. I want to slide the chest tube past my finger over the rib and into the chest. I pull my finger out, it's inside the chest. I want to make sure then to continue feeding that in with the pins, making sure that all the fenestrations are inside of the chest. Remember, when inserting the chest tube, you want to try to aim
Anteriorly for a suspected pneumothorax or aim posteriorly and superiorly for suspected blood.
and then mark the depth of that chest tube. Depending on what type of chest tube you may have a clamp down here at the sin that may be stopping any sort of fluid or blood from escaping from the chest. This chest tube itself does not require it. This blue device down here stops any sort of blood from escaping through the chest tube from the chest cavity. Once I've marked the depth of my chest tube, I'm going to look for fogging inside of the chest tube. And then I need to put it on my Heimlich valve. Depending on your branded chest tube, you may need to cut off the end. Other times you may just need to undo the clamp. Your Heimlich valve, it's a one-way valve. If you don't know which way the end goes, the blue end goes on. It's a one-way valve, allows air to escape and does not allow air to go back into the chest cavity. All right, let's suture this thing in place. Should have silk sutures or a similar type of suture, O-silk or something like that. When securing your chest tube in place, you're just going to simply do a simple purse string suture. It comes underneath the chest tube like this. Somewhat of a difficult position. Just modify what you need to do to ensure that you're getting a good suture in there. Once you have your purse string done, throw one overhand knot. And you're going to go back and forth up your chest tube. At any point in time you can, if you're done suturing, you can remove move your needle. So once you're sufficiently have your suture wrapped up the tube, just go ahead and place a piece of tape around the tube and make sure that you close in and secure the suture within that tape. All right, there are a lot of different techniques for securing your chest tube. The important thing is that you get a good seal on it and that it's not going to come out and you don't have any air or fluid escaping from the chest. In this instance, basically taking a chest seal type dressing, cutting it down the middle about halfway, and we're going to simply wrap it up and around the chest wall, kind of overlap it over the other one. Ideally, you'd have a similar second dressing where you could come over it in this direction, ensuring that you have a much tighter chest seal and on your chest tube. Okay, once that's done, the only thing left to do is really secure the chest tube against the body, just so you don't want this out here kind of flopping around. It can be done again in any number of ways, preferably just simply taping it against that body with silk tape. So once you finally have your chest tube in place, go ahead and monitor for any improvement in your patient. You're going to look for, continue to look for any fogging or blood in your chest tube. You're going to document any blood loss, and you're going to document the chest tube and all your care on a DD 1380 to ensure that that information is passed up the chain there to the receiving facility.